On today's presentation, we're going to be discussing some industry updates. Some states began opening up elective surgeries. The telehealth program continued expansion. Remote patient monitoring gains traction. Loans and grants. And you can now get MIPS credit for reporting COVID-19 data. Okay, so starting off with the elective surgeries, the American Hospital Association is now permitting some states to resume elective procedures. This is dependent on the amount of testing, the amount of PPE, and a steady decline of COVID-19 cases. Some other things that need to be addressed are the facilities need to establish a prioritization policy committee that has surgery, anesthesia, and nursing leaders to prioritize which patients need the elective procedures. Hospitals and health systems also need to put together a guideline for when to reassess a patient's health status. The system should use telemedicine as well as nurse practitioners or physician assistants to help with preoperative patient evaluations too. Testing is going to be another major pillar of any plan to resume elective surgeries. A facility should account for the time and frequency of testing patients to make the testing fast. A majority of the roadmap is that no facility should resume elective surgeries until they have at least 14 days of sustained reduction of COVID-19 cases in the geographic area, and the facility also needs to have an appropriate number of ICU intensive care unit beds and also non-ICU beds, PPE, ventilators, and staff to treat any non-elective patients. Okay, so the states that are currently doing elective surgeries are Oklahoma, Alaska, and Texas. And they are all slightly different. So we're going to get into these three states and what their plan is that are beginning their elective surgeries. So Oklahoma amended an executive order for elective surgeries to resume on April 24th. So that's in 2 days. The governor also signed an order outlining an elective surgery acuity scale for medical providers to follow regarding when elective surgeries can be performed during the COVID-19 state of emergency. All minor medical procedures and non-emergency dental procedures will begin on May 1st. So Alaska did something a little bit different. So Alaska says that all non-urgent or non-emergency elective services that cannot be delayed beyond 8 weeks without posing a significant risk to quality of life are to resume on May 4th. And the order additionally lays out a range of safety precautions that must be met in order for facilities, which explicitly include ambulatory surgical centers, to provide elective services. And the state of Texas said from April 21st through May 8th, the order says that health providers should continue to postpone elective procedures with the exception of those procedures that would not be expected to deplete hospital capacity or PPE needed to cope with COVID-19, or any procedure performed in a facility that has certified, it will receive at least 25% of its hospital capacity for COVID-19 patients and will not request PPE from any public source for the duration of the crisis. Okay, so some more information. This one is on remote patient monitoring. So remote patient monitoring is really big right now. It is ensuring that your patients are taking care of themselves at home. So CareOptimize can assist with device integration into your EHR system depending on the device, and there is funding that's available for this. So the funding will be targeted towards areas that have been hit the hardest by COVID-19. It is limited to nonprofit and public eligible healthcare providers, and the form that you can review to see if you're eligible is on the FCC website. It's Form 460. It provides immediate support to eligible healthcare professionals responding to the COVID-19 pandemic by fully funding their telecommunications services. And you must apply through PDF. Last time we checked, the portal was down, so you could try the website, but it may be down. You can still apply, though. So in order for your supplies to be covered, they must integrate with your EHR. So they must have Bluetooth or Wi-Fi connectivity, or it may be even your patient's smartphones, things like that. And there is are certain criteria that need to be met in order for you to be reimbursed for purchasing these services. Okay, so you choose, and then you submit your receipts for reimbursement. That's how the funding works for remote patient monitoring and the telehealth programs. So additional information on the FCC telehealth programs. So it also will assist with real-time audio video communication tools. So not just things that are related to remote patient monitoring, like those types of blood pressure cuffs, things like that, but also the tools that your doctor's offices need to the technologies that they need to treat their patients, the store and forward technologies that collect images and data to be transmitted and interpret later, the remote patient monitoring tools that I mentioned, and verbal and audio only and virtual check via patient portals messaging technologies are also included. So telehealth programs used to take about 2 years to implement, but with COVID-19, that time frame has been shortened to less than a month. So this is said to change the way medicine is being practiced forever, even though we need it right now due to the pandemic. These tools will still be available even after the pandemic is over. So there was a recent study that I wanted to mention that found that patients with diabetes are especially sensitive to COVID-19. So monitoring patients remotely is especially important for those patients. So GlideTech is a platform that offers insulin management software. It released an observational study on how diabetic patients are impacted by the virus. The study found that 29% of those with hyperglycemia while hospitalized died, compared to 6% for other patients. The researchers also found that the longer length of stay for patients with hypoglycemia, the study was based on 1,122 COVID-19 from 88 hospitals across 11 different states. In addition, the researchers found that 42% of those patients had not been diagnosed with diabetes prior to hospitalization and developed hypoglycemia while admitted. So that you might not be able to track, but if your patients do have diabetes, it's important that they are monitoring their levels if possible. Okay. Some additional information on the telehealth program. So more money has been released. 3.2 million of the 200 million for 6 hospitals in the initial COVID telehealth funding round has been delegated. FCC staff approved the first set of applications just 3 days after the application window opened. And the approved funding will go to the Grady Memorial Hospital in Atlanta, Hudson River Healthcare Incorporated in Peekskill, New York, Mount Sinai Health in New York City, Neighborhood Health in Cleveland, UPMC Children's Hospital of Pittsburgh, and the Oceaner Clinic Foundation in New Orleans. Okay, now moving on to some additional information on funding. So we have the Small Business Association loan that may eventually become a grant depending on how it's used, Paycheck Protection Program. So unfortunately, the first round of money ran out quickly, but fortunately, Congress has approved more. The money must be used to pay employees and expenses such as utilities, rent, mortgage insurance, things like that. You will only get this money as a grant not a loan if you do not have any layoffs. The money is also not to be used to expand your business. It's really just to pay for your essentials, like your patient's paychecks and utilities and things like that. It still remains on a first-come, first-served basis. Know your customer regulations must be dealt with by a bank that you already have a relationship with. So if you heard that one bank is very easy to work with, or maybe processed something very quickly, and maybe your bank is still not up to speed, you must stick with the bank that you're currently working with. So our recommendations, if you applied, is just to continue to be persistent, keep in contact with your bank, follow up, know where you're at in line, and again, be persistent because the money is out there. More was just released, so you will be able to get it. It just may take time, and you might have to be very persistent. Okay, now moving on to our HHS grants. So this funding has already been deposited directly into your clearinghouse or OptumCare portal, but there is a second round of funding that will be coming. There's currently no information about how much or how it will be delegated. We have heard that it may be geared towards hospitals, but that has not been confirmed as far as I know. Meanwhile, if you did receive funding from HHS, you are required to go to the link on my screen and do your attestation. So that has to be completed, I believe, within 30 days of receiving. So please go on that link and declare that you received your grant money from HHS. Okay, moving on to the Advanced Accelerated Medicare payments. So this is so that you can get, reimbursed your money more quickly, your payments. So providers, to qualify, you must have billed Medicare for claims within 180 days immediately prior to the date of signature on the provider's or supplier's request form. You must not currently be in bankruptcy. You must not be under active medical review or program integrity investigation. You must not also have any outstanding delinquent Medicare overpayments. So there are some forms that need to be filled out that are pretty extensive. So if you would like additional information on filling out the forms, we can send you a guide on how to do that. Also, if you feel that it's too much, we can also take care of this process for you. But you will be billed on an hourly basis if you wanted us to do it for you. Also, please be aware that this is not a loan. This money that you get in advance will have to be paid back from the date that your check was issued, depending on if you are a hospital or a physician's office. The date rate changes, but it will need to be paid back either within 210 days or within a year. So keep that in mind. This one is not a grant, it's just advance payment. Okay, CMS announces MIPS credit for COVID-19 clinical trial reporting. So this is new news. This is good. So new COVID-19 clinical trial improvement activity has been released. The clinicians must attest that they participate in a COVID-19 clinical trial utilizing a drug or biological product to treat a patient with a COVID-19 infection and report their findings through a clinical data repository or clinical data registry for the duration of their study. Clinicians who report this activity will automatically earn half of the total credit needed to earn maximum score in the MIPS improvement activity performance category, which counts as 15% of the MIPS final score. There are several trials providers can join, including the National Institute of Health Trials or a clinical data repository with Oracle. There will probably be some more information related to COVID-19 and MIPS coming down the line. Okay. On my screen, you will see some tools that we offer, CareOptimize offers, to help make COVID-19 reporting easier. So we are offering a complimentary template and a complimentary report. So the template is will show you can use to document if a patient comes in with COVID-19 symptoms. So not necessarily are they positive, but you suspect that they have it and you are considering testing them. You can address information like what was their temperature, were they wearing PPE, who was in contact with them, was their room sanitized, things like that. A corresponding document also can get generated to go along with it. And we also have a report, a CRISTA report, that will show a list of all of your high-risk patients. So we know that certain populations are more likely to get very, very sick from COVID-19. So, you know, your patients, as I mentioned earlier, with diabetes, they're over the age of 65, who have lung troubles, other chronic conditions, and our report will show you a list of all those patients that are at high risk if they were to contract COVID-19. So you could follow up with your patients with that report. Okay. So this is a little bit more information on the CRISTA report. We also have this tool called the Analitico Quality Gap Module. It takes the report to a whole new, it takes it another step. So the report is free, the template is free, but we do offer the Analitico Quality Gap Module, which typically we use for clinical quality measures. So we use it for your HEDIS, UDS, MIPS, you know, things like that to show where the gaps in care are. So we used that and modified it to work with our COVID-19. So you can very easily track and see if your patients have been contacted who are at high risk, medium risk, or low risk for COVID-19. So this is showing that, you know, out of the 312 patients that we have that are high risk for COVID-19, we have been in contact with 299 of them. So it just gives you like a visual to see how you're doing. And it works with other things, as I mentioned, like MIPS and HEDIS and UDS, other clinical quality measure tracking tools. Okay, so how does the Analitico Quality Module work? So it takes data from the HIE, claims, labs, hospital, eligibility data, and it puts it into our Analitico machine learning reconciliation, which then outputs information to health plans, registries, and supplemental data. The information is constantly going between Analitico and the EHRs, Analitico and the EHR, so that you can see very clearly in your EHR where the gaps are for the patient. So you can either view it in your Analitico tool, or if you're logged into the patient's record, you can see what they need to have addressed, like their mammograms, colonoscopies, flu shots, whatever measures you're tracking. It will actually show right on the SOAP template in your doctor's EHR, and then they can just click on it and order it, and once it's completed, it automatically updates your Analitico Quality Module. Okay, so that is all we have for today. We got the following information from our CareOptimize website, YouTube, COVID-19, CMS, FCC, and Innovation Match. If you would like any additional information on our complimentary COVID-19 tools, assistance with any of the grants, Analitico demo, anything, please feel free to contact me, lauren.pacone@careoptimize.com or info@careoptimize.com, and I would be happy to help answer any of your questions. I'm going to pause the presentation now, and we'll open it up for any questions. Janice, you're on the line. All right. Hi. Does anybody have any questions today? All right, everybody. So thank you for joining, and I will talk to you next week.